Good morning, everybody. My name is Sarah Bryan. I've been a labor nurse for 13 years, and today we are going to talk about breastfeeding and why it's the best choice for you and your baby. Think about this. It's 1:30 in the morning, and your baby is crying, screaming, and hungry and ready to eat. And now we have to get up, fix the bottle, get formula out, and get it all warmed up. But somebody didn't make it to the store in time, and now we don't have any formula to feed your baby. This is a problem that wouldn't happen if you chose to breastfeed. There are many benefits to breastfeeding, not just the readiness of food, but other benefits as well for you and your baby. One of the most important decisions that you will make after becoming pregnant is choosing whether to breastfeed or bottle feed your baby. This is a choice that only you can make, and you alone. A lot of times outside family wants to persuade you to breastfeed or to not do it because it's not convenient for them. This is a decision that you and your significant other need to make. A lot of times by educating your significant other and your family, it helps them to be more supportive of breastfeeding. We are going to talk about benefits of the mother. A lot of times people just focus on benefits of the baby only, but we're going to discuss some that benefit the mother. According to How Breastfeeding Benefits Mothers by Catherine Herman, breastfeeding can decrease the risk of postpartum depression. I recently interviewed a young lady who had 2 children. With her first delivery, she chose not to breastfeed and suffered from postpartum depression for many months, was on medication, and really struggled. During her next pregnancy, her and her husband talked about it, and they chose to breastfeed with her second child. Due to the release of hormones in her body, she did not have any complications with postpartum depression and had a more significant bond with her child during that time and was able to care for them because she wasn't on the medication for the depression. After delivery, you recover quickly while you're breastfeeding due to the release of oxytocin, shrinking your uterus back to the position that it needs to be in. Breastfeeding also reduces the risk of ovarian cancer and breast cancer by 4.3%. Reduces the risk of type 2 diabetes, rheumatoid arthritis, cardiovascular diseases such as hypertension. One of the biggies that everybody focuses on, and a lot of times is the only thing that they know about breastfeeding, is that it decreases your weight that you've gained. You lose weight more quickly with breastfeeding compared to bottle. You burn 500 calories a day while breastfeeding. If you breastfeed and do a healthy diet and exercise, that 50 pounds you put on during your pregnancy will quickly go away. According to healthychildren.org, a website that I recently researched, it not only benefits your health, but your pocketbook as well. You save $4 to $10 a day, which averages about $1,000 a year in savings when you breastfeed. This isn't counting your water bills that you're going to have to wash all these bottles, wash all the nipples, get everything sterilized. You're also saving the environment by not buying the cans of formula that are going to go into the landfill. So this is a green way to preserve our state as well. Now we're going to talk about the baby. We're going to focus on that for just a little bit. There are numerous benefits as well for the breastfeeding baby, and depending on how long you breastfeed depends on the benefits that the baby will reap from this. You have, the first step is colostrum, which is easily digestible and has a lot of immunity. This is called liquid gold to our premature babies. You can easily get the meconium out faster. If you breastfeed for 4 to 6 weeks, your baby has lower infection rates for digestive and respiratory problems. Decrease on SIDS. For 3 to 6 months, your baby is still going to be a healthier baby, and you have less ear infections and no constipation generally. For 6 months and longer, you have breastfeeding. You're going to have protective agents against childhood cancers. A lot of times this is when people choose to stop. If you continue to breastfeed for 9 months or more, your baby IQ can be 8 points higher than a normal formula-fed baby. Also, it's going to protect against diabetes, Crohn's, obesity, high cholesterol, asthma, decreased need for speech therapy and dental work later on. So overall, next time you are considering trying to breastfeed or formula feed, set your clock for every 2 to 3 hours and see how long it gets you to fix that bottle, prepare it, get it ready, and time yourself. And that much time is what you're losing in sleep each night. When you're thinking about breastfeeding, breast is best. Thank you for your time.